committee will come to order. Thank you all for being here today. I'm excited to kick off the work of the Ways and Means Health Subcommittee for the 118th Congress with today's hearing about unaffordability of health care in America. 13 years ago, the former President Obama signed the largest regulatory overhaul and expansion of federal health coverage since 1965. At that time, President Obama and the congressional Democrats made a lot of promises to lead up to passage and signage of Obamacare. Then Vice President claimed it was a big deal. Unfortunately, he was right. It has accelerated health care costs faster at any point in the last 50 years and created an unworkable federal bureaucracy and took away control from patients and doctors. Luckily, since then, congressional Republicans and President Trump worked to undo some of the damage the bill created, repealing the disastrous individual mandate, repealing the Cadillac tax, repealing the Independent Payment Advisory Board so our seniors can keep access to their care. Since 2010, however, the congressional Democrats and now President Biden have done everything they can to artificially prop up the Obamacare exchanges. The Congressional Budget Office's initial estimate for enrollment was off by 1/3, yet the Democrats continue down this road, called it a success. The only time enrollment has come close to the original projection was the Democrats spent billions of dollars to make coverage essentially free for anyone making up to $90,000 a year. In the spring of 2021, the American Rescue Plan included generous subsidies, convinced people to sign up for Obamacare plans while the number of enrollees increased. Those subsidies caused health care spending and inflation to go further in terms of inflation. They doubled down last year in the Inflation Reduction Act, which has instead continued fueling our current level of inflation by extending those federal subsidies for 2025. If Obamacare coverage is what people wanted, then why do they feel like they needed to bribe them to get them involved? Instead of just throwing more federal dollars at the problem, we need to come up with real reforms to our national health care system, both delivery and coverage of care, and put patients and doctors back in charge of decision-making, not the federal bureaucrats. Rather than government telling patients what they need, we must continue our work to help constituents get the right coverage for their family. For example, Republicans have promoted the use of associated health plans for small businesses so they can buy at a better rate and provide coverage to their employees. We've also returned the definition of short-term limited duration insurance plans to what it was before President Obama changed at the end of his administration. While there's no simple answer to bringing down the ballooning cost of health care in America, increasing competition, reducing government meddling, and putting patients and doctors back in charge is a good place to start. I worked with my Republican colleague on Speaker McCarthy's Healthy Task Force in terms of health care to come up with a patient-centered vision of how to reduce government involvement in medical decisions. The hearing is the first step to implementing many of those changes. The task force spent over 18 months meeting and numerous stakeholders, providers, patient groups, and others in the healthcare sector to gather recommendations on how to address the high cost of health care. I know in my district, in the last 8 years, it's gone up 75% in Florida. Congressional Democrats negotiated Obamacare behind closed doors. I introduced a resolution to require the negotiation takes place under the watchful eye of the American public. When then Nancy Pelosi pushed through the $1.2 trillion bill and cut a lot of different secret deals, so to speak. House Republicans, on the other hand, have worked to address the shortcoming of our nation's health care system through open discussion with various people in Congress so they can weigh in, as well as our constituents. We are on an unsustainable path of health care spending with over $4.3 trillion spent in 2021, accounting for nearly 20% of our GDP. It's at long last to work. We need to work together and find a way to rein in the spending and make sure we deliver for our constituents. With that, I'm pleased to recognize the gentleman from Texas, Mr. Doggett, for his opening statement.
Thank you, as always, Mr. Chairman. Through healthcare crises like the COVID-19 pandemic, right up to the economic challenges caused by Putin's brutal aggression and war crimes in Ukraine, the Affordable Care Act has been the safety net that has kept so many Americans covered and healthy. Increased enrollment in both Medicaid and the marketplaces actually reduced uninsured rates modestly, during the pandemic, despite the fact that many were losing coverage with initial job losses and economic turmoil, a situation that was, of course, made much worse by Trump's denial, delay, and dithering regarding the pandemic. Affordable Care Act coverage has also ensured providers receive stable payments. That's been essential for rural hospitals and other healthcare providers so that they can stay open and assure patient access. Whether it's an unexpected medical emergency or a diagnosis of some dread disease or just day-to-day wellness checks, the Affordable Care Act is there for patients and for providers. In my home state of Texas, a true mark of the success of the Affordable Care Act is the fact that last year we had a 42% in 1 year increase in the number of those who enrolled in the plan. Now over 2.4 million Texans are insured through the marketplace. Their families don't just have insurance, they have quality health care protection that covers their essential needs, and they don't have to worry about being disqualified because of a pre-existing condition. Though the Affordable Care Act does permit discrimination, does not permit discrimination, too many, primarily from communities of color and low-income families, are still not receiving any benefit from it. I'm pleased that today, North Carolina finally joined the majority of states doing right by expanding Medicaid coverage. Those who are denied the benefits of the Affordable Care Act result from the kind of obstruction that we have in Texas, where Republicans continue to deny access to a family physician for almost as many Texans as the number who benefit from marketplace coverage. As if 50 or 60 previous votes in this committee and this Congress to repeal the Affordable Health Care Act and losing 3 lawsuits were not enough, today we have yet another hearing to complain about the Affordable Care Act. Well, while there is health care inflation, no doubt, it hardly began with the Affordable Care Act. Health care costs have been soaring much more rapidly than the overall cost of living for decades. Returning to the days of fine print limitations, junk insurance, and exclusions and denial of coverage at the very time the coverage is needed the most will not lower anyone's health care cost. That will only deny health care coverage to Americans. Instead, we must work to tackle the long-standing distortions in our health care system. And of course, the poster child for that is pharmaceutical prices. Big Pharma continues to spike prices year after year. The most recent data shows an average 31.6% drug price increase, almost 4 times the inflation rate. Pharmaceutical companies use government-approved monopolies to extract the highest prices in the world, despite American taxpayers financing and underwriting so much of the research and development for new drugs. Instead of rewarding taxpayers for their investment in drug research, manufacturers price gouge and manipulate the patent system to wrongly extend their monopolies and fend off good old American competition. While innovators certainly deserve a profit and an incentive to innovate and reasonable patent protection, layering patents to extend monopoly power and monopoly prices for decades is an outrageous failing about which this Congress has done very little. Charging Americans up to 6 times as much as patients in other countries for a drug whose development relied upon taxpayer dollars is certainly not reasonable. Some of us have been working for years to repeal the ban on drug price negotiation and place some restraint on these aggressive monopolies, yet it still remains illegal to negotiate on the vast majority of drugs, and for the handful that will be subject to negotiation, no price reduction will occur for more than 2 years, and then, unless you rely on Medicare, you get no benefit whatsoever. I hope that in coming months, our committee can work on a bipartisan basis to seek ways to have a productive response to health care price inflation instead of just relitigating worn-out and unsubstantiated accusations against the Affordable Care Act. And I yield back, Mr. Chairman.
Thank you, Mr. Doggett, and I also look forward to working with you and see if we can come up. We know we've got some challenges. Let's see what we can do about moving the country forward on health care, and I know you're committed to it, and so am I. I'm pleased to recognize the chairman of Ways and Means, Chairman Smith, for his opening statement.
Chairman Buchanan, Ranking Member Doggett, I'm pleased to join you in convening this first hearing of the Health Subcommittee in the 118th Congress. It is also a first step in a renewed effort to address the high cost of health care in America. Thank you, Chairman Buchanan, for your leadership, your knowledge, and your expertise. Your background as a business owner will ensure the success of this subcommittee in advancing policies that can lower the cost of health care for more Americans, for small businesses and their employees. The high cost of health care is a painful reality for many Americans. In field hearings, we have heard how small businesses, particularly those in rural communities, are struggling to attract and retain workers, and the increasing cost of providing incentives to do so. Health insurance is one of those key benefits, but unfortunately, costs have been steadily increasing. One survey showed 91% of small business owners rated addressing healthcare costs as a major priority. While the rising cost of healthcare has been a challenge for many years, we also know that higher inflation today has driven up cost. Today, families are paying nearly $2,000 more out of pocket than they were 2 years ago. Medical supply costs have increased 15%, which makes it harder for independent medical providers to keep their doors open and treat patients. We need solutions that offer patients and small business owners greater choices and flexibility. In today's hearing and in future hearings, including field hearings, we will examine the many factors driving the unaffordability of healthcare and what can be done to expand care to communities who today see hospitals and clinics closing because they can't afford to keep the lights on. But the cost of care is only so important as families actually having access to care. I look forward to both this subcommittee and our full committee diving further into some of those issues. We will listen to the American people, including those workers, families, farmers, job creators. We are meeting in our field hearings across the country. Through that work, we will identify the problems and the solutions in which I hope will be a bipartisan effort to address rising healthcare costs and improve the access and quality of care available to all Americans. I yield back, Mr. Chairman.
Thank you, Mr. Chairman. I now will introduce the witnesses, and I'm very excited. We've got 3 or 4 people that have been in business, and some of you since 1970. You look too young for that, but I'm just very excited about having people because you make up the real world. You're the job creators, and I've been in business like you did, started businesses back 40 years ago with a couple employees and a couple of bucks and built something up. But all of us want to do what we can to help you. One of the things is addressing the cost of rising healthcare costs. So you're going to be able to deliver that reality to us, hopefully, today. So the witnesses, Kelly Moore is the owner of NAPA Auto Parts. Matt Neiswanger is the owner of his family medicine business. Brian Bass is a president of Paragon Health Institute. Karen Carahan is president and CEO of a small business and entrepreneurial council. And Patricia Kamar is the senior director of healthcare campaigns at the U.S. Public Interest Research Group. Ms. Moore, we'll start with you.
Chairman Buchanan, Ranking Member Doggett, and members of the House Ways and Means Subcommittee on Health, thank you for inviting me to testify today on behalf of the small business community. As said, my name is Kelly Moore, and I am the owner of 3 Napa Auto Parts stores in Eastern Ohio. In 2004, my husband Greg and I bet on the promise that through hard work, we could achieve the American dream. We opened 2 stores, put everything on the line to do that. We had 20 team and family member employed. The hard work paid off, and we opened 2 additional stores in 2006. In 2017, we combined 2 of our stores and closed 1, so we currently own the same 3 stores. Our employees are the lifeblood of our company. Our employees are incredibly valuable, well-trained, and we rely on their dedication, resilience, and their passion for our business to help the business thrive. When our business thrives, so do we, but so do our employees. Their well-being is a top priority for my family and me. One of the most significant challenges we face is the affordability of health insurance. Another challenge we face is retaining our valued employees and filling open positions with qualified candidates. We wanted to be sure we were offering a competitive local wage and a competitive benefits package. Making matters worse, small business owners do not have the scale or regulatory flexibility that large corporations enjoy, making it difficult for us to compete, especially when it comes to being able to offer health insurance. Before the Affordable Care Act mandates were imposed, we paid 80% of the premiums for our employees and their dependents. However, every year after the enactment of the ACA, my insurance premiums increased by double digits. In 2010 alone, the very first year, we experienced a 30% increase in premiums. Not only did we as a business experience that, our employees experienced it in their share of the premium. By 2015, the year-over-year increase was 21%. By 2016, it was 18%. And in 2017 benefit year, it was scheduled to be an additional 24% year-over-year increase. During the 6 years following the ACA, we were forced to scale back our premium contribution in order to afford our insurance premium. We scaled it back to 70% and eventually to 60%. We made other changes as well. Additionally, our employees could no longer afford the plan we could secure with the plan's exorbitant deductibles and out-of-pocket limits. We were forced to terminate health insurance in 2017. It was a gut-wrenching decision. I lost sleep. I spent a lot of hours making phone calls, trying to crunch numbers, trying to find a way to insure those employees. But the search for individual plans by my employees was even more frustrating and confusing. The terminology of health insurance plans, the apples to oranges comparisons, the unfamiliarity with the limits associated with different plans, they left our employees both disgusted and disgruntled with the ACA. Currently, our employees have coverage due to recent legislative and regulatory actions. We reinstituted coverage in 2019 when the Tax Cuts and Jobs Act small business deduction allowed us to deduct 20% of our pass-through income. In 2020, a change in the regulations by the Trump administration allowed Napa Auto Parts to offer an association health plan. If either of these valuable government policies were to expire, we would no longer be able to afford or offer health insurance as a benefit and an attraction to new employees. The status quo is unsustainable. We need cost containment, choices, flexibility when it comes to our health insurance so that we can provide the best possible coverage for our employees without breaking the bank. In closing, I would like to thank the committee for allowing me to testify, for listening to the small business community's concerns, and for your efforts to empower the small business owners, especially in the arena of healthcare. I will answer any questions.
Thank you, Mrs. Moore. Mr. Neiswanger, it's recognized.
Chairman Buchanan and Ranking Member Doggett, members of the subcommittee. My name is Matt Neiswander. I'm from Lawrenceburg, Tennessee. I'm a first-generation cattleman, a family nurse practitioner, and the owner of Neiswander Family Medicine. I'm here to highlight the difficulties and struggles that farmers and ranchers, small business owners, healthcare workers, and middle-class families like mine encounter every day pertaining to the cost of high-quality individual health insurance. Small businesses like mine are struggling with the cost of providing insurance to our employees. And also I want to discuss how increasing operating costs are making it a struggle to continue to take care of our communities. I have the honor and responsibility of supporting 9 families as employees of my medical practice. Last year, we celebrated as one of my nurses found out she was expecting her 3rd child. Her and her husband decided to check on insurance through the marketplace and found that they could get a bronze policy coverage plan for their family for $150 a month, but with a $14,000 deductible. Her husband owns a small dirt excavating business and has no option for coverage through an employer, and we did not offer employee coverage at the time. So we decided to check on the cost of providing that benefit to all of our employees. To cover just our employees and not their families, it was going to cost our office $34,000 a year for a plan that our employees would pay around $350 a month for a deductible of $12,000. If we decided to cover our employees and their families, my business costs skyrocketed to $140,000 for the same plan coverage. Here I am running a medical practice and I can't even offer medical benefits to my employees because of the cost. How is a small business supposed to budget for these ridiculously high prices? And even if I could afford to offer my employees insurance benefits, why would I want to pay for something that's going to cost them $350 a month and $12,000 annually before it even helps them out? At this point, my employee decided to sign up for the bronze high deductible plan. She then paid $250 at every OB appointment during her pregnancy and then $1,800 immediately after delivery for a total of over $4,000 and a $14 deductible that was never met. You'll be happy to know the mother and baby are doing just fine, but their budget is not. The costs to operate small businesses like mine have increased substantially in the last few years. Not only have the cost of supplies increased threefold compared to pre-pandemic prices, but supplies have even been unavailable at times. Before 2019, we bought gloves for $10 a box. That same box of gloves is now $30. How can we continue to afford these price increases? We provide health care to almost all available insurance plans in our area. The problem is that we have no bargaining power concerning the payments from these insurance companies, and payments from these companies have remained the same even though our expenses have skyrocketed. We've seen many of our uninsured and Affordable Care Act covered families struggle with the decision of making a house payment and buying groceries versus taking care of the uncontrolled diabetes and high blood pressure that require an office visit and prescription medication. As the cost of living and stress, especially for healthcare workers, increased exponentially during the COVID-19 pandemic, my employees needed and deserved raises that we gave them during this time. But due to the economic stresses, we had to carefully weigh the viability of our practice with increased expenses and the same amount of income. Instead of increasing our prices, we're getting creative and trying to rent out space in our office for other medical professionals to practice and offset our expenses slightly. But mostly, we just take the loss ourselves to continue to support our employees and our community. I don't know how many medical offices have or can continue to absorb this cost, but in towns all over rural America, medical practices like mine and hospitals are closing, and there's no new providers coming in to fill those gaps in those communities. The ACA may have wanted to provide high-quality, affordable insurance plans for Americans, but in rural America, working-class families are not seeing that. The families in rural towns are getting older, have lower incomes and budgets that can't include health care, and have less access to primary care providers and specialists than ever before, with less than 10% of medical providers choosing to practice in rural areas due to a more complicated aging patient population covered by Medicare and Medicaid with lower reimbursement rates. Access to those providers is only going to get worse. Maybe the ACA has decreased the number of uninsured individuals in America, but how do you expect people to use insurance that's going to make them pay more than $14,000 annually before it ever helps them out? And if they decide to use that coverage, rural Americans are having to travel farther, wait longer, and require more extensive care than ever before, straining the healthcare system even more. Benefits attract the best talent, but how can businesses be expected to sign up for terrible insurance coverage that costs us as much as hiring an additional full-time employee? And as the expenses of operating business continue to increase, the options for redefining and pivoting become fewer and fewer. Rural America is increasingly becoming a desert for medicine and a graveyard for our friends and families because we lack the access to affordable, high-quality insurance as we are simultaneously running off the doctors, nurse practitioners, nurses, psychiatrists, and specialists to treat the unique needs of our rural towns. My wife and I are the sole owners of our medical practice. And we've decided medical care for the people is more important than the profit. But there is nothing affordable about the care that the federal government is acting like the rural Americans are getting. Thank you, and I look forward to your questions.
Thank you, Dr. Blaze. You are recognized.
Thank you, Chairman Buchanan, Ranking Member Doggett, members of the committee. It's a privilege to testify before you today, particularly since I was once a House staffer. My name is Brian Blaze. I am president of a new health policy think tank, Paragon Health Institute, and my testimony today represents my own views. I will focus on how well-intended government policy aimed at making health coverage and care more affordable often does the opposite. For example, the Affordable Care Act caused premiums to soar. Individual market premiums more than doubled in the first 4 years after its implementation, yet plans covered fewer doctors and hospitals. By 2021, the average ACA plan premium plus deductible for a family of 4 exceeded $25,000. Since coverage is cost prohibitive, most enrollees need extremely large subsidies to afford these plans. Taxpayers pay for more than 80% of the premium on average and pick up almost all the cost of premium increases over time. This gives insurers significant pricing power and in turn leads to higher premiums, an inflationary spiral. At the outset, it's important to acknowledge some basic truths. First, the U.S. does not have a free market for health care. Half of U.S. healthcare spending is by the government. Most of the rest is heavily impacted by government policy. As government's role in healthcare has expanded, prices have skyrocketed. Hospital prices have increased more than any other major economic sector, rising 3 times faster than inflation since 2000. By contrast, in sectors where government's role is minimal, inflation-adjusted prices typically decline while quality improves. Too often, high healthcare prices and spending don't correspond to high value and improved health. For example, the ACA expanded coverage and significantly increased spending primarily through Medicaid, but American life expectancy declined for 3 straight years following the ACA's coverage provisions taking effect. In fact, Americans' life expectancy was lower in 2019, before the pandemic, than it was in 2013. There is too much government bureaucracy in healthcare. Government rules, despite good intentions, often restrict options for coverage and care, stymie innovation, and prevent providers from being able to best meet their patient needs. Government also mismanages programs to an epic degree. There's $100 billion in annual improper Medicaid payments, for example. There's too much insurance bureaucracy in healthcare. Insurance is important, but having insurance pay for routine and shoppable services leads to overconsumption and waste. People often secure better prices by not using insurance. One study estimated that cash prices are 40% cheaper than prices with insurance. For healthcare services where third party is limited, such as cosmetic surgery and LASIK, real prices have declined while quality has increased. Moving forward, you should keep 2 principles in mind. First, policy changes always produce unintended consequences. We should evaluate the outcomes, not the intentions behind policies. For example, many ACA proponents thought it would reduce ER visits because people would get a usual source of care. The exact opposite happened. ER use surged with the ACA, often for non-emergent care. Second, when government subsidizes something, it becomes more expensive. Subsidies increase demand, raise prices, and increase total spending, and must be funded by taxpayers. Both the American Rescue Plan Act and the Inflation Reduction Act expanded the ACA's already substantial subsidies. Most of the benefit went to people who already had coverage. Families with incomes well above $250,000 now qualify for large subsidies. The expanded subsidies incentivize employers to drop workplace coverage, raising overall deficits. And all the new spending on the expanded subsidies also increases inflation. Congress should consider building on existing policies that expand coverage options and improve incentives, including association health plans, which allow employers to have economies of scale in obtaining health insurance for their employees, making coverage more affordable. Individual coverage health reimbursement arrangements enable employers to offer coverage by making tax-preferred contributions that their workers can buy coverage that works best for them. Price transparency rules empower patients and employers to know prices before purchasing services, and health savings accounts give people incentives to ensure value from their health care expenditures. In conclusion, Congress should trust people and let Americans have the freedom to spend their own money on the health care and coverage that works best for them. Thank you again for the opportunity to testify today, and I look forward to any questions.
Thank you. Ms. Kerrigan, you are now recognized.
Good afternoon, Chairman Buchanan, Ranking Member Doggett, and members of the committee. Again, my name is Karen Kerrigan, and I serve as President and CEO of the Small Business and Entrepreneurship Council, SBE Council. It's an honor to be with you this afternoon to explore how high costs are impacting small businesses and possible ways we can strengthen and improve affordable health coverage and increase flexible choices for entrepreneurs and their employees. Access to health care has remained a core issue for our network of small business owners since our founding nearly 29 years ago. Both in good economic times and in bad, the cost of health care has remained one of their top issues of concern. Obviously, the sting of higher costs is felt more acutely during challenging periods or times of high inflation and economic uncertainty, as we are currently experiencing. And indeed, inflation and higher costs are hitting small businesses hard. These increases stretch across inputs, including health coverage costs. Inflationary pressures have been a painful drag over the past year or more, and recent surveys show that inflation continues to rank as a top concern. An Upswell Small Business Owners Survey reports that 47% of respondents cite inflation as their top concern, 17 points higher than a year ago. A February 2023 Goldman Sachs 10,000 Small Businesses survey reported that inflationary pressures worsened over the past 3 months for 72% of the business owners polled. Higher health coverage costs are adding to the pressure. An October 2022 survey by Small Businesses for America reported that 41% of small business owners said that the rising cost of health insurance caused them to increase prices of goods and services. These cost pressures come on top of the challenges small business owners are facing when it comes to finding and retaining workers and upward pressure on labor costs in general. Indeed, next to inflation being ranked as a top challenge, filling job openings ranks as a close second or on par with inflation. That is why business owners view benefit offerings such as health coverage as a competitive necessity in their efforts to attract and retain employees. Health coverage costs have been increasing every year. 2023 is no different. Many of our small business members have reported increases in the range of 5% to 20%. This is unsustainable, especially in the current environment. As my written testimony points out, small business owners place high importance on access to health coverage. When asked to identify the biggest benefit of offering health coverage, business owners say it is to promote the health and well-being of their employees. That is, providing health coverage is the right thing to do. But only 17% of small business owners believe that the healthcare solutions available to them have kept up with changing times. They want policies that provide them with choices, relief, and incentives. In our survey, 72% believe that employers and employees, not the government, should decide which health plan to offer workers. Congress can support small businesses by reforming existing programs, options, and policies, and make targeted improvements that would lead to increased small business coverage. In my written testimony, I note areas for possible reform, enhancing the small business healthcare tax credit, making targeted fixes to QSERAs, enhancing health savings accounts, and tax changes that would produce equity for the self-employed regarding their ability to exclude health insurance premiums from the self-employment tax. SBE Council looks forward to exploring these solutions and others, including how telehealth, immersive technologies, and Web3 can play a growing role in delivering quality care in cost-effective and innovative ways. Obviously, the health and well-being of all of our citizens are critical to the competitiveness of our nation. Certainly, this is a vital issue that drives the viability of so many of our Main Street businesses and firms. I look forward to our discussion today and follow-up conversations in the future that will lead to meaningful reforms for small businesses and their employees. Thank you.
Thank you. Ms. Kelmar, you are recognized.
Thank you very much, Chairman Buchanan, Ranking Member Doggett, and members of the subcommittee. I'm Patricia Kelmar, the Senior Director for Healthcare Campaigns for US PIRG, the Public Interest Research Group. We are nonprofit consumer advocates who have been working for 50 years to protect consumers. We're aligned this afternoon in a common mission to identify the best solutions to high prices that we pay so health care can be affordable for everyone. Every week, I interact with patients who contact us for help in solving difficult medical problems. For example, David, an engineer, and Christy, an IT analyst, who shared their experience with the birth of their first child last fall. Baby Theo arrived early and was having breathing difficulties. The doctors at their local hospital recommended specialist care at the nearby children's hospital. Theo was transferred by ambulance 16 miles to get to the children's hospital, and he was able to receive the care that allowed him to go home with his folks just 2 weeks later. The grateful parents had paid their deductible and their out-of-pocket maximum when the hard bill came in. What put them over was the $7,000 bill from the ambulance company. Insurance had paid $1,000, but the couple was shocked to learn that they had to pay the remaining $6,000 because that 16-mile ambulance ride was provided by an out-of-network provider. They tried negotiating with the health plan and the ambulance company. Unsuccessful, they had to set up a 30-month payment plan with the ambulance company, which means that baby Theo will be almost 3 years old by the time they end up paying off that medical debt. Circumstances like this can set families back for years, struggling to pay for expensive medical bills that they can't control or negotiate. In the US, we rely on several different types of insurance. It comes in public programs like Medicare, Medicaid, and through private insurance through our employers or unions or through the ACA marketplace. Insurance works when everyone has it because we spread the costs of all that care amongst a broader population. And the ACA has enabled us to get most people insured, filling in those gaps. But when the prices of care are so high, health insurance, no matter how we design it, won't change the amount that we have to spend. 3/4 of the money that is spent in employer insurance goes to prescription drugs and the services provided at in and out of outpatient hospital facilities. Prescription drug prices have increased 60% in the last 10 years. Even with insurance, 1 in 4 families find it difficult to fit prescription drugs and medications into their family budgets. They either don't fill their scripts or they skip doses, all resulting in worsening health. And the high prices charged by hospital-owned facilities make up more than half of our insurance healthcare expenditures. Tremendous consolidation is driving up prices. With recent vertical integration, those high prices from hospitals are coming into our own family-owned and smaller healthcare physician practices that are being bought up by the larger conglomerate. And those prices are set by that larger healthcare system, not by our local providers. The patient is last in that conversation. They're the ones who are paying the prices. Private equity investment is also growing in the healthcare sector, and of course, they have to maximize profits for their ROI. These higher prices have not improved the quality of care. So the most effective way to achieve affordability is to address high prices of prescription drugs in particular and hospital-based services. Those are the cost drivers. And the best way to do that is by improving competition and constraining overcharges in both of those sectors. You've already made very important headway with the important bipartisan law of the No Surprises Act, which prevents over 1 million surprise medical bills every month, and with the ability for Medicare to negotiate prescription drug prices in the coming years. But we can do better. When generic drugs come to market, we know that competition can drive prices down by as much as 80%. We need to put an end to the tactics like patent thickets, product hopping, and other mechanisms that keep generics and biosimilars from making it to our pharmacy shelves. We need a menu of tools to address the impact that consolidation has brought on prices and causing them to go up. We need greater enforcement against anti-competitive practices and ensuring that nonprofit hospitals promote and distribute their financial assistance money to people that need them. States are even experimenting with good ideas like cost containment boards, and California is, frankly, actually making its own medications to address high drug prices. It's time for bold, innovative price containment ideas to help the millions of insured Americans like Christy and David, so they're not staying up at night wondering if that next cancer diagnosis or car accident will end up putting them into bankruptcy. So thank you very much. I look forward to taking your questions, and thank you for listening to the perspective of the consumer today.
Well, thank you, and I want to thank all of you for your testimonies. Now we'll proceed to the question and answer part. I'll go first. Ms. Moore, it looked like you had started back in business in the 70s or so. That's when we first started. But I know for 20 years that I was in business, the first 20, we paid for, we only had 5, 10, 15. We paid for everything, 100%. There was no deductibles. And it seems like in the last 10, 15 years, it's got pushed. That's only impacting in a negative way small businesses like yourself, but it's got pushed to the families. Where we used to pay everything, now we pay half, or we pay 60%. They're picking up 40. And then you want to wonder why is it that so many people seem to be working paycheck to paycheck? One of the biggest reasons, in my opinion, is just because of the growth of the cost of health care and having to pick it up. It impacts small business, but that family of 4 is typically in every area it's different, but let's say $1,600, but they're paying $700 a month out of pocket. So what is your experience with that as you look back? Is it the same thing where everything's been accelerated? I'm not looking to place blame, but I'm just looking at what the reality is for you, someone like yourself.
We inherited the health plan when we opened our first stores from the previous owner until that premium period ran out. Back then, our employees had a $500 deductible. Like I said, we not only covered employees and dependents, we offered spousal coverage at that time. With the ACA came the challenges of meeting payroll and also health insurance. Payroll was a time in business that quite frankly, the 2008-2009 recovery time wasn't coming fast enough for businesses like mine. So what happened was we dropped that coverage for spouses. Then we had to decrease the premium contribution, as I said, from 80 to 70, then 60. We ended vision, life, and dental insurance coverage for our employees. But I am glad to tell you that because of those changes made after 2019, I guess they were enacted in 2017, 2018, we were able to reinstitute not only health insurance, but pay 100% of the life insurance policy for our employees and all of their dental and vision.
What is your cost for a family of 4?
For health insurance
Yeah,
or total?
you've got an employee who's married, has 2 kids. What are you paying per month or per year? And I'm saying not you, just
Yeah.
overall, what's the bill? And then what do you split it then? How do you split it today?
Currently, the bill for 9 and eligible employees who are taking advantage of ours is $7,800, and they are paying a portion of that.
And what are they, do you mind me asking, what are they paying, their portion? Are they paying half?
60% of that, so you are looking at,
4,000 or 5,000 a year
Yes.
then they're paying?
yeah.
And that's
And-
my point, that's the point I was
And
trying
these
to get
are
at.
the median income in our area is about $50,000 for a household income, median
So
income.
that's a lot of money, 4,000.
That's a whole lot of money.
And I want to touch, because it's not about tax, but you did say 199A, because you're a pass-through entity, and you took advantage of that 20% reduction, because a lot of people don't understand it passes through you, yourself, and if you're married, your husband. But explain that a little bit more, how that made the difference for you, that 199A. It's just obviously less taxes, you're able to cover more for the employees. Is that what happened?
That's exactly what happened. And in addition to that, we were able to take some of that income and boost our inventory. Our inventories had been dwindling because of the cost of inventory was escalating. So that 20% not only helped us cover health insurance, it helped us meet some other significant expenses for our business.
And let me just switch gears here a little bit. Mr. Nice-Wonder, let me ask you, your business, you have what, 9 employees, did you say?
Yes, we have 11, including me and my wife.
Okay. Let me ask you about your patients. You're in a rural community. What are they doing for insurance? Are most of them on Medicare and Medicaid? But what are the small business people or people who are trying to buy insurance that don't have that coverage? Someone's mentioned that 50% of people have some insurance through the government or whatever, but there's another 50% or more, whatever that number is, that does. So you've got your experience, but what are you finding about just the rural community in general in terms of who pays what and how much?
In our practice, about 40% of our patient load is Medicare and Medicaid insured patients.
Okay, and then what, in terms of the people that don't have the coverage, what are they doing for insurance? Are they coming to your office? Do they have insurance, the small business people like yourself?
The ones that we see in our community that are covered under Medicaid and ACA coverage oftentimes don't come to our office because of the looming fear of that $14,000 deductible that blue-collar working families like myself just don't have in the bank.
Yeah, I seen a poll today, and I'm glad to get it out to everybody, but they were saying, it was shocking to me, 40% of people don't go to the doctor or something because they can't afford to pay for it, and 25% of that, or say 25% of the total, basically have real issues, and they're serious issues. They know they need a doctor, but they don't do it because they can't afford to pay the bill. Thank you, and I'll now recognize the gentleman from Texas for any questions he might have.
Thank you, Mr. Chairman, and to all of our witnesses. You know, it really is remarkable that today we're celebrating the 13th anniversary of the Affordable Care Act. It has been amazingly resilient. It survived literally dozens of attempts in this committee and other places within the Congress to substitute nothing care for Obamacare. It's been all the way to the Supreme Court 3 times with one lawsuit after another, and it has been upheld. And we've had 4 years of sabotage by President Trump. I think that against that background, the fact that so many Texans decided last year to vote themselves by enrolling in the Affordable Care Act is an indication of the value that it offers. Let me ask you, Ms. Kelmer, before the Affordable Care Act, we're all concerned about rising prices today, but before we had an Affordable Care Act, were healthcare prices for goods and services soaring and high above the ordinary cost of living index?
Healthcare prices have been rising for decades. It has been higher than inflation, and it has continued to rise. So, yes.
What about those individuals who have no coverage at all? Will providing people nothing care so that they're without insurance, what will that do in terms of decreasing healthcare cost?
The average amount of money in a person's savings account in the U.S. is about $400. And when we can see just one simple ambulance bill being, $6,000, we just know that folks don't have that kind of money to pay off a bill in an emergency situation, let alone be able to go to the doctor for their regular preventative checkups. That's why insurance is so important, because it allows us to spread the costs among wider populations, helping everyone to be able to access that care that they need, whether they're healthy or very sick.
How about these junk insurance policies that President Trump was so fond of that excluded essential services? Some of them had pre-existing condition limitations. What do those do to reduce the cost of health care?
So the best insurance is the one that is promoting the primary care and the preventive services and covers those kinds of treatments, and then make sure that we're trying to look at the broader population health. So when we have gaps in coverage and the important treatments aren't provided, then people ignore the care or can't get the care. Or alternatively, they're going into debt to get the care, which makes them a less active member of society and the economy. So it's really important that our insurance programs are reliable, trustworthy, that we can depend on them to provide the care that we need. But that's the reason why we really need to get at the price issue. because prices of insurance are going up because of the payouts to the drug companies and to the hospitals for that care. So we need to get a handle on those prices, and we need to probably come up with a menu of solutions in order to address them.
And I believe you had a statistic about drug price inflation. Of all the forms of healthcare inflation, aren't drug prices right at the top?
Certainly, and a lot of that has to do with the fact that we have not been seeing the kind of generic competition that we need in the marketplace to make sure that we can bring down drug prices. With just the introduction of a couple of drugs into the market to compete, that enables people to shop around, or the insurance companies, in this case, to shop around and get a better price and bring down the drug prices in the marketplace. So it's really important that we encourage greater generic and biosimilar competition, and we break down those barriers that are keeping them off the shelves.
I think every significant new drug approved in the last decade has had significant taxpayer funding in the research, and yet taxpayers don't get any break. They have to pay more than people in other countries, and we face continual resistance in this Congress to doing anything about that. Similarly, you referenced other problems that could help bring down prices, such as dealing with the role of private equity, which has been involved in the consolidation and increase in prices in many parts of the healthcare industry. Similarly, the important work of the Biden administration through the Federal Trade Commission is often overlooked, but when you have monopoly, whether it's in prescription drugs or in some other healthcare sector, you get monopoly prices and things are driven up. So many areas we need to work together on and overcome lobby resistance to try to bring healthcare costs down. Thanks to all of you.
Thank you.
I now recognize the gentleman from Nebraska, Mr. Smith.
Thank you, Mr. Chairman. Thank you to all of our witnesses for sharing your perspective and your insights. Where do I begin? The cost of health care, pre-inflation, that we've seen in the last couple of years was bad enough, and now it's even worse. I grow frustrated when there are comparisons made that, from the dais perhaps up here, that aren't really reflecting reality. I'm concerned that the overall cost of health care has driven up health insurance plans for workers, public sector and private sector. I marvel at the fact that before Obamacare, I can't quite call it the Affordable Care Act because I don't think that's accurate, but before there was this outsized intervention by the federal government, we had, high-risk pools that existed that, yes, those premium levels were offensive. They were painful. But now it seems that everyone in the individual market, now that they pay a similar amount, it's not as offensive. I worry about things like that. And I worry about the fact that a recent Gallup poll found 38% of Americans delayed medical treatment in the last year because of cost concerns. I worry that the cost of medical equipment and supplies has increased 15% just since the beginning of the Biden administration. Hospitals have seen nearly a 25% increase in labor costs per discharged patient since the beginning of the pandemic. I could go on here with further notes, but suffice it to say that we've got a worker shortage. We had a worker shortage even before the vaccine mandate. Found out perhaps a vaccine mandate wasn't as productive as some would have argued. We've finally gotten rid of that. But there's been a lot of pain along the way. So I hope that we, as a combined body of policymakers and certainly experts with some great insight, that we can have the conversations that we need to have to deliver better results for the American people. I believe my colleagues who supported Obamacare meant well. The results, I think, have been disastrous. I think that my colleagues who supported the spending 2 years ago out into the economy against the warnings of economists, very reasonable economists, against the warnings that it would trigger inflation, I worry that those results have also been disastrous. So as we sort out all of this and hopefully get our country on a better path, certainly as it relates to small businesses, actually workers in whatever size business. I hope I can experience better results moving forward. But Mr. Nicewander, I have to say I'm impressed with your diverse professional background, and I'm guessing that you provide some great services to your community and help feed the world. I appreciate that. Can you perhaps tell us how the rising labor costs have specifically impacted your business across the industries in which you work, and what you would do if the cost of paying your employees increased by another 25% over the next 3 years that we're all fearful of?
So like I mentioned in my opening statement, prices have increased threefold, and we're talking about basic supplies to run a medical office: Band-Aids, syringes, needles, things that are fixed that I can't pass on to the patient, things that I can't control there. We're talking about pennies sometimes, but the price of syringes, for instance, has increased by about 15 cents a piece, which doesn't sound like much, but when you use hundreds a week, that adds up to your bottom dollar. That has impacted us, that we can't offer those costs that we would have maybe paid for health insurance. We can't offer that to our employees. We can't retain the talent that we need. We can't invest in new and better technology to better serve our rural communities that don't have access to those new and advancing technologies. But for me personally, it created a lot of sacrifice. I'm a first-generation cattleman, and since I was 16 years old working on a dairy farm, I dreamed about having a farm. I bought that farm in 2014, and last year I had to sell it in order to keep our medical practice alive and our patients taken care of and my employees' families fed. I don't have another farm to sell.
Thank you. And I don't have a lot of time left, but I hope that we can get to the point where we truly address cost rather than just shifting around who pays for what and saying everything's all better. Thank you. I yield back.
I now recognize the gentleman from California, Mr. Thompson.
Thank you, Mr. Chairman, and thank you to all the witnesses that are here today. I really, truly appreciate my Republican colleagues giving us an opportunity to point out and talk about the healthcare cost issues that we face collectively. I believe strongly that every American should have access to quality, affordable health care, and want to work to make sure that becomes a reality. I do wish, however, that my friends on the other side would help us figure out how to address these issues rather than just spend all their time criticizing why the many things that we've done to date haven't completely solved this issue. The issue of access to quality, affordable health care has long been something that has plagued us before the Affordable Care Act and after the Affordable Care Act. But I think it's important to point out that last year it was Democrats that passed legislation allowing Medicare to negotiate the price of prescription drugs. That provision alone is going to save Americans and the Medicare program billions of dollars on their prescriptions. We also passed legislation capping the price of insulin for Medicare beneficiaries at $35 a month, and now that's being followed by private sector providers as well. And of course, 13 years ago, as has been pointed out, we passed the Affordable Care Act, historic legislation on which tens of millions of Americans rely for health insurance, and which, for the first time, required insurers to cover a range of mental health challenges that all Americans face. Unfortunately, my colleagues who are quick to criticize also voted against all of those provisions. So no to lower drug prices, no to affordable insulin, no to mental health coverage. Over 70 times they voted to do away with the Affordable Care Act. But all their efforts failed because the law actually does work. I'm willing to work with anyone to lower the cost of health care, but let's be honest, virtually every step Congress has taken to lower health care costs has been opposed by my friends on the other side. I'd like to enter into the record a statement from Keep Us Covered, which outlines why the Republican proposals some of which are being discussed today, like the individual coverage HRAs, will undercut the gains made in the ACA and allow for discrimination against workers. Mr. Chairman? Without objection? Thank you. And I want to also point out that the average premium for ACA plan in my district was $697 without subsidies, but $241 for those eligible for the ACA tax credit. And also, I want to point out that California's uninsured population dropped from 17 to 7% after the ACA was put into place. And then, as I mentioned before, the ACA provided mental health coverage to an estimated 48 million people who otherwise would have gone without that help. I have a couple of questions. Ms. Kerrigan, you talked about the importance of telemedicine. That is something that, ironically, has good bipartisan support. Legislation of mine was put into the COVID legislation that expanded telemedicine for Medicare folks. It's created a very safe environment for people to get health care, and we've actually extended that. I believe that we should really expand telehealth and provide that access to folks who are in Medicare and others as well. Could you talk just briefly on how much that will help with access and how much it will help with affordability?
Oh, I think it would be extraordinary and significant. And it was also great to see at the end of last year the CARES Act piece where employers could reduce covered telehealth services by allowing employers to provide pre-deductible coverage for such services. That's been extended, and I think that needs to be made permanent. But absolutely, technology can play a big role in reducing healthcare and giving people more access to healthcare. I think particularly in rural areas too, where you do have, the challenges cited by the other witnesses in terms of, hospitals being closed or closing and not having access to not having access to providers. So. People who don't have, people who lack mobility. I just think all in all, it will do a lot to help drive down the cost of health coverage, give people more access, and just help the system just be more productive and efficient.
Thank you very much. Mr. Chairman, Mr. Swiker and I have telehealth medicine, and we'd appreciate any help you could provide to get that marked up and onto the floor.
I look forward to working with you. I'd like to recognize the gentleman from Pennsylvania, Mr. Kelly, who's obviously, like myself and some of us up here that have been in business a long time, has dealt with this issue head on. So, Mr. Kelly?
Thank you, Chairman, and thank you all for taking a day out of your life to come down here. We've been attempting since the session started to go out into the country. So we were in Oklahoma one time, and we were in West Virginia another time, in very small communities. And Ms. Moore, I'm also in the automobile business. So I'm really interested, when I looked at your input for this, and I hear your testimony, I can't help be impressed by your story. What you and your husband have been able to accomplish is the American dream. I don't know that you had a lot of government help doing that. I think once you became profitable, the government came knocking. And we find many ways to shake pennies out of people's pockets because we're going to do it the right way. And we're only $33 trillion in debt, so I would challenge anybody, if you want to watch a model, please don't bring anybody here in to tell you how to run your business. So, but looking at what you do, and I know this because I'm the same way, and the same as Mr. Nicewander, how many sleepless nights do you have trying to figure out how you're going to make payroll? And how many times do you have to you pay everybody but yourselves in order to keep that talent there? Now, you did talk a little bit about inflation because there's many times we talk about things and it kind of takes your mind off of what's really happening in your store, in your neighborhood, in your county, in your state, and in your country. So can you talk a little bit on what inflation and supply chain disruptions how it's impacted your business and how you've had to adjust the benefits that you provide for your employees?
Well, with the supply shortages are critical. I've shared this with a number of people, but in key lines, we're getting shipped at 40 to 60% of what we order. When those orders come with a discount, which we then are able to pass on to our customer. When we cannot secure those with a discount, we're having to get rapid items much more expensively. So it's driving up not only our costs, but also the costs of our customers. Putting a hurt on the small business customers we have. Not everyone is a giant corporation in our area. Most own a garage or diesel mechanic shop and help out with the stone haulers or the cement workers. The fleet garages are our big customers. So supply shortages continue to challenge us. We're thinking of creative ways. We're looking for outside suppliers, but then you have a product that you may not be familiar with, you may not have experience with, so warranty items become an issue.
Yeah, and you know, we're in the same position. I think any of us that are in businesses know how tough it's been to attract talent and give the benefits package to them that they need to have in order to, because you're in competition with everybody else that's looking for talent.
Yes.
So the benefits package is a big deal. So Mr. Nicewinder, just between the two of you all, I said, and I'm sure Vern's gone through the thing, there's many nights without sleep. Miss Miller and I agree on everything because she's also an automobile dealer. But if you all can talk about it, because it comes down to this. We're talking about health care and how it is soaring, the cost of keeping people healthy. What is it that we could do? And you want to keep these benefits there to attract the best people to address the people that you serve. So, Mr. Nicewinder, I don't know how you've done it, but having health care in a rural area, being able to take care of those folks and knowing that your model for a profit is very small and leaves little room for any types of mistakes. And that's why I think we keep talking about we're going to get good health care for people. Say, I really appreciate that. I can't afford anything we're doing right now. We started off at 80-20, then we went to 70-30, then we went to 60-40, and right now we're contemplating going to 50-50 because we can't afford to be in a competitive area with another person who sells the same products as we do, and it all is based on total cost of operation. So, Mr. Nichols, just share a little bit. I mean, for you to do what you had to do, and keeping the medical part going right now, the rural part, and calling on people and trying to keep them healthy.
There's a word that my colleagues here and some of you had mentioned, and it's the word affordable. And you talked about the out-of-network ambulance ride. You tout uninsured Americans. What good is that insurance if they get a card with their name on it, but they can't use it? Access to health care is a problem. Mr. Doggett mentioned maintaining, keeping rural hospitals open. Texas leads the nation in closed hospitals in the last 10 years. In my state of Tennessee, 16 hospitals have closed in the last 10 years. 13 of those have been in rural areas. My hospital in my county is on the verge of closing. The county next to me just closed last year. Access to health care is a problem, people. It's not affordable. Families are having to drive from my practice over 2 hours to get to a specialist, as simple as an ear, nose, and throat doctor. It's not that there's not one closer. Medicaid pays, on average, about 60 cents on the dollar compared to commercial payers. What physician's office wants to accept that? They drive past 10, maybe 20 specialists to get to the one that will accept their insurance. People in my community don't make a lot of money. $36,000 is the average income. You're asking them to pay a $14,000 deductible, drive 2 hours to get to a specialist, take a day off work that they can't afford, that's going to take food out of their kids' mouths. Affordable Care Act is anything but that.
Thank you.
I now recognize the gentleman from New York, Mr. Higgins.
Thank you, Mr. Chairman. It's obvious that we're still discussing health care, that, there are still many challenges in front of us. I believe that health insurance companies jack up premiums, and then when you go to use the health care that you've already paid too much for, there's very little underlying insurance. And that was a problem before the Affordable Care Act because people could market junk policies that really didn't mean anything to anybody other than the temporary satisfaction that you had health care. since the Affordable Care Act, I voted for it. Not perfect by any means, but 35 million more people have health insurance that's more affordable because of the Affordable Care Act. Prior to the Affordable Care Act, if you had a kid that was stuck with cancer, insurance company could deny you coverage because of a pre-existing condition. You can't do that anymore. It's against the law. Policies have to cover pre-existing conditions. What are they? Diabetes, cancer, epilepsy, lupus, asthma, pregnancy, and that's just part of the list. So the insurance companies always had the upper hand. The idea here was to pool the American people so that there was leverage to negotiate a better deal for consumers that they didn't have on their own. And if the Affordable Care Act is so bad, why did our colleagues' efforts 51 times to repeal it fail? Because maybe it's not perfect, maybe we can do better, but the Affordable Care Act is better than what we had. And the whole objective was to bend the cost curve and to increase the number of people that would have health insurance coverage. Both objectives have been met. You talk about the high cost of premiums, you're right. Before, it was about 15% annually. Bending the cost curve is not taking away the annual growth in healthcare premiums, it's lowering them. Are they as low as we want them to be? Absolutely not. But if this Congress worked in a bipartisan way, like we did with an infrastructure bill which was bipartisan, we could create a better program than the Affordable Care Act. Why aren't we allowing people to buy into Medicare at 50 years old? They would save 40% on their premiums. You wouldn't have to create a new program, just allow them to enroll in the program at their own costs. So I guess my point here is that, you know, we're not defending the perfect here. Everybody, even the most vociferous proponents of the Affordable Care Act, were acknowledge that it's not perfect and we still have a long way to go. But every story that you tell, the problem with rural areas, that we don't have doctors and nurses and healthcare providers, they don't want to go there. Why? Because there's not the population where they can make as much money as they otherwise would be able to do in a more densely urban or suburban area. So we all have an obligation on both sides of the aisle to do a lot better for you. The Inflation Reduction Act, again, was just a start. I've been here for a lot of years, and everybody's been talking about why aren't they authorized to negotiate drug prices? The VA does it, and they realize a significant reduction. Why? Because life and insurance is all about leverage. So why wouldn't we use the leverage of Medicare beneficiaries to lower the cost and drive up the quality of health care on behalf of all of you who have a personal story that I believe. So the Inflation Reduction Act begins to do that, but unfortunately progress in Congress is typically very incremental. We should be making major progress to hold down the cost of insulin, which this bill does, to hold down the costs of individuals on a yearly basis to $2,000. But they're never a finish, they are a start. And all of us should demand much better from Congress, particularly hearing your stories, and particularly when it comes to the high cost of health care. With that, I'll yield back.
Thank you. I now recognize the gentleman from Ohio, Dr. Winstrup.
Thank you, Mr. Chairman. Thank you all for being here today. Of course, we all know that the inflation that we're dealing with today is not helping the situation whatsoever. And you know, people talk about insurance as though that equals care. And I think most of you on the panel know that doesn't equal care just because you have a policy. When we talk about negotiating drug costs, there's a difference between a negotiation and a dictation. And if there's a dictation and it's take it or leave it, and then you're left out, then that drug is no longer available, and it stymies the possibility for more research and development, and we have to be considerate of that. And I am bothered when I hear my colleagues say things like they want to accomplish something on this committee, but then they say Republicans are for nothing care. Well, I'm sorry, but that reminds me from a line in The Princess Bride. We are all men of action. Lies do not become us. So let's have serious conversation. We're about a healthy America is what Republicans are for. We're about prevention. We're about diagnosis and treatment and making America a healthier place. But what we don't want is the government in between the doctor and the patient. And I can tell you that firsthand, and I know Dr. Murphy can as well, and I know Mr. Niswander can as well. That is part of the problem. So when you're trying to create savings, you created the problem, is interfering with the doctor and patient. Look, I love our safety nets. I'm proud to live in a country that has programs like Medicaid and Medicare. And especially with Medicaid, though, I want fewer people to need it, not more people on it. And that is a difference between Republicans and Democrats. Democrats call success putting more people on the government program, when we say success is fewer people needing it. When I started in practice, I had 2 employees. And if someone was sick, my mom came in. You can probably relate to that, right? And a patient came in, if it was just for an office visit, I gave them their bill, they paid it, then they submit it to insurance. Now we get the government involved. And now everything's got to change, and I got to hire more employees, and I've got to, file all the claims, and I got to have every word perfect in the chart. You know, there was one time I had a patient, he said, "Oh, Doc, how much is this going to cost?" And I said, "Well, I can numb you up here in the office, and it's about $300. And he said, "Honestly, I don't have any money." And then he said, "You know what, I raise chicken. You like chicken?" I said, "You got a deal." You can probably relate to that, too. And I didn't expect anything of him. But he delivered with that, by the way. And I took care of him. But now you can't, because now you're giving someone a special favor because of all the rules coming in from the government. Oh, no, you're giving favoritism to one person over another. How about you're helping somebody in need? And why can't that be okay? But that's where we are today. So I went from my practice, I had to grow my own administration, then I joined a large orthopedic group. And, recently, because of things like decreased reimbursement to physicians, the change in the Surprises Act that HHS put in, that we didn't put in the law, the bipartisan bill that we passed, they changed the rules to favor the insurance companies and drive down what you pay doctors. That's when they quit. And that's when they quit taking call. But that's what our government is doing. I do have a rural community in my area, and a lot of rural communities. And one of the doctors, he said, "I just don't take insurance at all, because mostly what I do are office visits. And if I have to refer to a specialist, that's when their insurance kicks in, but they just pay me a small amount, and it's half of what it would be if I was taking Medicare and everything else." And it works. It works in that environment. So we got to get the government out. And to the point, too, the other large orthopedic group in our town, they went private equity, and they quit taking Medicaid. When I first started, if I saw 1 or 2 Medicaid patients a month or something like that, I didn't care. That's about all I saw. But as the numbers grow, you can't keep your doors open. It is a business, right? And it's very hard. So my question for you, Mr. Niswander, I think this can kind of hit home with everything, because I talked about the need to practice with very little assistance in the office. You said you have 11 employees. How many of those actually touch patients and provide medical care?
Every one of them.
So out of 11, you have them all, so there's no one who's just administrative. There's no one who's just, that's what I'm trying to differentiate.
So we have a billing company and a company that processes our claims for us. That's 2 separate companies there. We pay them a percentage out of our income as well, out of every claim that's processed.
Okay, well, for many people, that's in their office, and those are the employees.
That's correct.
So you have people producing, but you do have to pay for all the administrative burdens that have been put on us over the years. Well, I think this is what we have to focus on. And let's focus on the health of America and our patients. And be sure that when we're doing something from the government level, we're actually helping, not hurting. Now yield back.
Thank you. I now recognize the gentleman from Pennsylvania, Congressman Evans.
Mr. Chairman, I want to thank you for calling us together to mark the 13th year since President Obama signed the Affordable Care Act into law. First, Mr. Chairman, I would like to ask to submit the testimony of Walter Rowan, co-chair of the Small Business for America's Future and president of the Susquehanna Glass in Columbia, Pennsylvania, for the record. In his testimony, Ms. Rowan states, before the implementation of the Affordable Care Act, securing affordable health care for small businesses and their employees, there was a much more hostile battle. However, the act has revolutionized the landscape for providing affordable options to small businesses through initiatives such as the Small Business Tax Credit, the Small Business Healthcare Option Program, Marketplace, and the Individual Health Insurance Marketplace. He goes on to say, it also helps spark a wave of new small businesses by incentivizing people to take the leap into entrepreneurship. And towards the end, he states repeatedly, or weakening the health care would be a blow to the vital small economic contributions. It's important. Mr. Rowan makes clear, however, the Affordable Care Act has helped small businesses across America, and I thank him for sharing his testimony with us. The Affordable Care Act was a life-changing law that improved countless lives. I will list just a few examples. The ACA provided coverage to millions of Americans and initiated over 21 million through Medicare expansion and over 16 million who enrolled in marketplace plans. The ACA people were successful in preventing, and it is important as he says, the ACA did something amazing. It for the first time gave people a sense of hope. No, it is not perfect, but it gave people a sense of hope. I want to take a moment to talk about the medical debt the Affordable Care Act made and what it attempted to do. More than 100 million Americans are thriving dealing with this issue of medical debt. Let me say repeatedly that over 100 million Americans. In the past 5 years, more than half of U.S. adults repeated they fought against this debt. I want to thank, though I was not here, and the members who took the lead on this issue. It was like working together that made a difference. We cannot afford to go backwards. American families cannot afford having more costs through on their budgets. And it is important that it will only work when we work together. President Biden has moved in the right direction when he called the Affordable Care Act a big deal. Said it a little stronger than that. I look forward to working with my colleagues in trying to provide and make sure that health care is a reality. No, it is not a question that is perfection, but it is the issue that we all must work together. So I sit here today saying to my colleagues on both sides of the aisles that yes, we can help and be beneficial. We must keep that in mind in terms of who we are working for. And it is important to recognize that the people are really watching all of us in terms of our ability to make a difference. Not a question of repeal, but a question of how can we do better. I would say to you, Mr. Chairman, that this hearing is a beginning. We must keep working together. Thank you, and I yield Files the time back, Mr. Chairman.
I like that mindset. This is the beginning, so that's my goal. Pursuant to committee practice, we will now move to 2-to-1 questioning order. I recognize Congressman Dr. Murphy from North Carolina.
Thank you, Mr. Chairman, and I want to thank all the witnesses for coming today. This is a difficult problem. It is a strangling problem. Medical debt is the #1 cause of bankruptcy. But let's look at the facts. I love my Democratic colleagues, and we're throwing all these platitudes forth, but you are guys that are in business and actually seeing real-life things compared to folks that just sit and calculate things. Oh, is that like muted on purpose?
I'm trying to tell you something.
I think they are. Look, I'm amphibious. I can move to a different one. So, all right, it's back. Now I'm in stereo. I've lived in the real world. I've practiced for over 30 years. I've run a practice. I knew where every paperclip was as far as our overhead, and then I worried. There were several quarters where I never got paid because we had to pay for our employees. And we debated, because when I first started practicing, we paid for every penny of our employees. But let us look at what's happened with government health care. So let us look honestly, objectively, at what's happened since Obamacare. And I'm going to give you a few parameters that show us what it has done has been abysmal to medicine. Since Obamacare, 1/4 of physicians more have had their practices fail in one way or another. And then what happens? They do one of 3 things. They either quit because they can't take it. Number 2, they get assimilated by a hospital where the cost of care by an employed physician is close to twice what it is for a private physician. Or 3, they just take cash. And we're seeing more and more and more of this, because if you look at what has happened to premiums, let us look at real cost of health care. It has skyrocketed since Obamacare. Why? Consolidation. That is the #1 reason where you have monopolies, not only with hospitals and large systems, and God has given me a voice now, not only with large systems, but look at insurance companies. Look at PBMs that have actually destroyed pharmaceutical medicines, the cost of pharmaceutical medicines. So let me ask you this, Mr. Niswander. If it continues on the present trajectory, given the cost of living, the crippling cost of inflation over the last 2 years, the fact that you can't charge anymore for Medicare patients because your cost, you can charge them, I love this, I could charge $1 million for a surgery, but I'll still get $150. Doesn't matter what I charge, but what Medicare pays, Medicare pays. Where do you see your practice in 5 years?
So currently, we've been able to continue practicing medicine. Nurse practitioners make less and get reimbursed less. My employees don't get the benefits that large systems do. We've tried to rent out space for other medical professionals to practice to kind of offset our costs there. And as I mentioned, I sold my farm in order to keep our office going. And you're correct. Right now, we've got a problem where rural hospitals are closing, and they're our backbone of our rural communities for these families to get health care. Instead, they're having to drive several hours away to find that same hospital for emergency care. I don't have another farm to sell. I mean, you look at this happening again, what am I supposed to do? Practices like mine, I've had 2 close in the last year, primary care offices, and those offices are not being filled. They're up for sale. Nobody wants to buy them. Medicare reimburses 60%.
In rural areas, I don't want to interrupt just because we have a limited amount of time, but the way this trajectory hits and continues is the cost of care goes up until nobody can afford it anymore.
That's correct.
We spend now, everybody talks about Medicare for all. They have an absolute no understanding of what that means. Absolutely no. It makes them feel good inside, makes them feel great inside, but they have no clue as to what that means. Because the cost of care, we had to fight tooth and nail against the other side so that physicians would, and providers would only be cut 2% last year rather than 8%. So you cut to feed a absolute monstrous government bureaucracy which has grown and grown and grown in the last 13 years until you can't cut anymore. And people say, the hell with it, I'm done. We're going to have a cataclysm occur in the next 3 to 5 years with surgeons in this country because nurse practitioners, PAs, can't do surgery. They can help with primary care. They can't do surgery. So, no, there were some good things with the Affordable Care Act. There were some good things. But what it's done to medicine as a whole has crippled this country. I thank you for what you do, but it's important that people who are in the field give testimony to what they're doing. Not only people that own small businesses, but people who own practices. So you're in double jeopardy there because you're getting your rates cut at the same time. You can't expense it more, the time that inflation is killing you. Thank you, Mr. Chairman. I'll yield back.
Thank you. I'm excited to always have two doctors on this committee because you've worked in the real world, not just in medicine, but running a practice, running a business. So we appreciate your knowledge and capability. And I want to recognize the congressman from Oklahoma, Mr. Hearn.
Thank you, Mr. Chairman. You have 5 business people in a row here. I spent 35 years in business, running all kinds of businesses, owning, operating, from aerospace to agriculture to banking, and then 34 years in McDonald's franchises. I've never seen something so convoluted as the healthcare industry in this country. And it hasn't gotten simpler. Having seen hundreds of thousands of dollars taken off the bottom line and wasted when you could supply health insurance to your employees. In any other industry, you'd know the cost of service of the product you're buying, and as a consumer, you can shop and for the best price. But in healthcare, people have no idea the true cost of their healthcare service or the treatment. It's the only thing you buy, if you think about it for a minute. It's the only thing you pay for that you don't know what the cost is before you get it. The exorbitant costs of the health care are masked by subsidies, tax credits, employer and insurance contributions. Not a single person in this room could tell me the true cost of their last health care appointment, and that's the problem. Unfortunately, the hidden cost of health care exacerbated by the Democrat policies. Just last year, my colleagues on the other side of the aisle voted to completely hide the cost of health insurance under the disguise of free, zero-premium health care for many Americans. The expansion of the Obamacare subsidies cost the American taxpayers $64 billion, but the greatest cost of all is to the society. We need a safety net for people that are falling on hard times, falling through the cracks, but not families that are making upwards of $600,000 as we're currently seeing. We need safety net that empowers people. Hiding the cost of health care through government subsidies blindfolds families who are already struggling to pay their bills under Biden inflation. We shouldn't be surprised that Democrats keep pushing for these policies. My colleagues today will point to reports with increasing enrollment in the Obamacare markets and Medicare rolls. It's not a victory to have health insurance card in your pocket, but no cash in your wallet. I think you said that earlier. Yeah. Especially if the service that comes with the health insurance card are too expensive. Democrats are misleading Americans, telling them that they have care when all they have is a plastic card. The actual care costs are even more. Coverage mandates began with the passage of Obamacare over a decade ago. Since then, Democrats have continued to almost exclusively focus on those policies in the individual market, have done nothing to help the 48% of Americans who obtain their coverage from their employer. It should come as no surprise when there have been no work for Democrats to salvage their failed small business exchanges and small business health tax credits. I would encourage my colleagues to go to healthcare.gov/smallbusiness and see for yourself that small businesses have no options for coverage in the SHOP exchange in many states, including my own home state of Oklahoma. And no SHOP insurance means no access to the small business tax credit, which explains why only 6,000 people used the small business tax credit in 2016. Let me say that again. There are 33 million small businesses in America, and only 6,000 were using the tax credit. It's really sad that Democrats could expand Obamacare tax credits for a family making nearly $600,000, but do nothing to fix Obamacare's broken small business provisions. But this is a new day in the House of Representatives. The American workers spoke loud and clear last November. America's workers are tired of being left behind and punished for pursuing the American dream. I'm proud of the healthcare policy platform we put together and the commitment to America with the Healthy Future Task Force over the last year. As chairman of the Task Force Affordability Subcommittee Chairman, I want to quickly highlight some reforms that this list that our committee should consider. Make healthcare, first one, make healthcare coverage portable through ICRAs. Make healthcare savings accounts accessible to more people. Reduce the Obamacare paperwork burden on small businesses, and allow businesses to join together through association health plans. Mr. Blaze, we've spoken many times. You did a lot of great work on that year of work. We've seen a highly mobile labor market, and now more than ever, workers need health care that is portable. Can you speak to how health and reimbursement accounts provide American workers and employers more flexibility?
Yeah, thank you, Congressman. It's the new individual coverage health reimbursement arrangement. They took effect in 2020, and it allows employers to offer a contribution that workers take and then buy the individual plan that works best for them. So it's really, I mean, it's the small business owners, they care about their workers, they want to offer them health coverage. It's about trusting people to make the best decisions for them and giving them as many options as possible for their coverage.
What's been the effect of the expanded subsidies on the employer market? CBO and JCT estimate that 2.3 million employers would drop coverage, and do you agree with that estimate?
Yeah, I actually think it could be more than that if the expanded subsidies are made permanent. The expanded subsidies are really large, so it provides employers with an incentive to drop coverage. They could increase wages when they drop coverage and have their workers qualify for expensive tax credits in the exchanges that just add to deficits and just worsen the overall inflation problem.
Thank you, and I yield back.
Thank you. I now recognize Congressman Davis, the gentleman from Illinois.
Thank you, Mr. Chairman, and let me thank you for calling a very informative and important hearing. And I also want to thank all of our witnesses, and I appreciate greatly the voices that we're hearing today from small businesses. But I'd also like to note that not all small businesses are expressing the same sentiments. And I'd ask unanimous consent to submit for the record a statement from Small Business Majority, whose opinions are quite different. As a matter of fact, their opinions suggest that efforts to chip away at the ACA will only serve to disrupt the marketplace and in turn harm small business owners, their employees, and self-employed individuals. If the Republicans are successful in repealing the Affordable Care Act and substantially reducing Medicaid, Illinois families will have higher health care costs. Without the ACA, 68,000 Illinoisans will have higher premiums, up to an average of at least $6,500. At least 2 million people in Illinois with pre-existing conditions will be subject to the denial of health care insurance coverage and charged more by market health insurance enterprises. We would be looking at 4.5 million Illinoisans at risk of lifetime benefit caps. Ms. Kelmar, if I could ask you, if the ACA is appealed, what would be the impact on mental health?
It's already very difficult for people to get mental health services and to pay for it out of pocket. So having a good insurance plan that covers that and offers that is a really great way to not only make sure that folks have the coverage for the kinds of care that they need, but we all know that a good mental health plays into your physical health as well.
And just thinking of average basic health care that several million people now have been able to acquire coverage who otherwise would not and did not have it prior to ACA, what would be this impact on the economy and the economics of the environment where they are?
Well, people need insurance because there's no way they can pay for all of their care out of their own pocket. And wages will never cover those kinds of costs, especially for the sickest. So the reason that the United States has moved towards an insurance system is because it spreads out the risk and it spreads out the costs of the most sick people onto everyone, so everyone can have access to care. Having a good insurance policy also enables us to be able to get that preventative care that we need to make sure that we're not getting sicker And we have to address, we have a very different healthcare system right now than we have had in the past. With the consolidated health markets, we're seeing prices just skyrocket. And there's no ability for insurance plans to be able to shop around and find another alternative when that community only has one consolidated health system demanding the same prices throughout. So we really have to get to the cost issue to make sure that the health insurance programs that we are running in the U.S. are paying reasonable prices and not inflated prices.
Let me thank you very much. I come from a school of thought that says, let the good outweigh the perfect, and I think this is one of those instances where that's the case. Thank you very much, and I yield back, Mr. Chairman.
Thank you.
Thank you. I now recognize the Congresswoman from West Virginia, Ms. Miller.
Thank you, Chairman, and thank you, Ranking Member. And thank you all for being here today, because it helps to have people testify on the real impacts from the policies that come out of Washington, D.C. About a month ago, this committee met in my home state of West Virginia, and we heard about the tangible impacts of the failed Democrat policies, many of which have contributed to record high inflation, and what effect they're having on the folks outside of the Beltway. One of the most compelling testimonies that I heard was from a lady named Ashley Bachman, who owns a restaurant in Petersburg, West Virginia. And she testified that she was unable to offer health care to her employees because of how expensive it was. And as a matter of fact, her whole family is uninsured because she can't afford the monthly health care bill on top of all the costs associated with her business. And I was really kind of sorry to hear that story. Ms. Moore, first of all, I want to thank you for showing the respect that you have for your employees and how important they are to your business. So many times people in this bubble they seem to think employers are the bad guys, and you're not, and you do really appreciate your employees. You shared the difficulties of being a small business owner in the Appalachian region. Ohio's part of the Appalachian region. You talked about your experience having to cut health insurance benefits for your employees. Can you just talk a bit about making that decision and how hard it was as a business owner?
I will share, and I will try not to tear up, because these are individuals. We know their children. We know their extended families. Not because I grew up in those communities that I have business in, only because we have a relationship as an employer-employee relationship that extends far beyond a paycheck. When I had to look an adult man in the face and tell him, I can't help you anymore, find insurance for your family, for your 2 growing sons, and I know that your wife is not eligible at her employer for insurance, so I'm going to leave the whole family of 4 out to defend for themselves. I can't do a single thing for you. I couldn't even, because of the mandates, supplement and give him extra money to help find. I mean, my hands were totally tied.
I hate to stop you, because we only have so much time, and I'm really happy that you are now able to reinstate their health coverage. You know, your employees thankfully have health coverage, but most people in rural America still do not. So now I need to ask Mr. Niswander a couple questions. You know, being a healthcare provider for such a rural community certainly gives you a unique insight into the struggles of rural America and what we face when trying to receive health care. Have you seen patients who are unwilling to get treatment for their medical services because they're worried about the high costs?
I have actually. Just last week, I had a patient that came in that I haven't seen for a long time, who's a very brittle diabetic, who needs several bottles of this $30 insulin every month that she can't afford. And she delayed care for many months, even from calling me, to the point that her foot developed a necrotic wound that put her in the hospital with a high deductible plan on the ACA coverage. She came to my office with a wound vac attached to her foot and talks of amputating that foot now. It was the fear of that high deductible plan that kept her from getting care.
It's just so difficult for patients to physically travel where they need to, let alone receive the care, and it's a shame that the cost of care is just another barrier. It seems another issue I feel is an obstacle to quality health care in rural America is the difficulty retaining a robust rural health workforce. And I think you all agree to that. Can you talk just a bit about finding healthcare providers to come and join your practice?
It's difficult in rural America. The insurance reimbursement rates, like Dr. Winstrip and Murphy are aware, are fixed. We have no bargaining power whatsoever. Expenses are going up. The pandemic's over, but the price increases are not. That translates into many medical practices closing down because of the strain that it puts on the ones that are left. He talked about mental health resources. Over 70% of psychiatrists do not accept insurance because the reimbursement rates are so terrible. Our patients are suffering because rural America's hospitals and medical providers are shutting down left and right.
You're exactly right. Mr. Chairman, I yield back my time.
I now recognize the gentleman, the congressman from Pennsylvania, Mr. Fitzpatrick.
Thank you, Mr. Chairman. And thank you to the panel for being here today. Many employees are seeing their insurance premiums rise, and at the same time, hospital finances are worse than they've been in recent memory. In my district in Bucks County, Pennsylvania, many hospitals that I hear from are experiencing what they refer to as unsustainable losses. Mr. Niswander, how have you dealt with facing narrowing or even negative margins for the care that you provide in your institution?
We have fixed costs in medicine that we cannot pass along to the patients. They just are what they are, and we have to have those things to operate. We have nurse practitioners that earn less. My employees don't get the benefits that they deserve and need. And me and my wife often eat the cost. Patients come in with high deductibles, and we give our care away completely for free. I don't know how many hospitals, I don't know how many medical primary care physicians can do that or continue to do that, but I know that they're closing down left and right in rural America.
The reality is there are hospitals losing money in southeastern Pennsylvania, the region I represent, and also across the entire country. But at the same time, costs of providing health insurance for employees have gone up significantly. If premium increases are not translating into greater financial stability for these struggling healthcare providers, my concern is those increased premium costs are being lost to inflation and other sectors of the healthcare market, threatening to leave hospitals and other healthcare providers like Mr. Niswander, leaving you with difficult choices that generally lead to either reduced access to care or further increased prices for patients. Mr. Blaze, what do you think has been the primary factor of driving these insurance costs up? And do you think patients and small businesses could see even further price hikes in response to some healthcare providers continuing to struggle?
Yeah, I mean, I think there's two reasons, Congressman. One, the other witness talked about the growing consolidation in the healthcare sector. That really accelerated with the ACA, with hospitals merging and with hospitals acquiring physician practices. The ACA had one provision that reduces hospital competition, so they prevent Medicare payments from going to new physician-owned hospitals, which is anti-competitive. And whenever you have anti-competitive policies, that's going to increase overall costs. I do think, too, just the design of the health insurance. Like, we talk about health insurance is expensive because healthcare prices are high, and that's true. But you also have the issue that when government mandates that health insurance be very expansive and then heavily subsidizes that health insurance, those things increase healthcare prices as well. So the government regulation over what health insurance has to cover, the very expansive subsidies that have been added to in the Inflation Reduction Act also push up healthcare prices.
Ms. Kelmar, how do you think hospitals struggling with increasing costs is ultimately going to impact patients?
What the problem is that we can't see a lot of the quality measures that we really need to see, and that we are still paying very high prices for. So we're in a system that we spend most of our healthcare dollars, especially in the commercial market, as a fee-for-service payment system. And so that means the more things that you do to a patient, the more money you can make. and that drives up prices as well. So between the consolidation, which is pushing our prices up because there's less competition in those local markets, and the way that we pay on the fee-for-service system, those are the kinds of things that keep driving up those dollars that are coming out of our insurance, which is causing pressure on both the businesses that are and our employers who are trying to offer us our health insurance, but then they're having to shift off that extra cost onto us in our out-of-pocket premiums.
Thank you. Mr. Chairman, I yield back.
Thank you. I now recognize the gentleman, Congressman from Virginia, Mr. Byer.
Mr. Chairman, thank you very much, and thank all of you for this. It's been a very fascinating hearing, and I've really appreciated hearing from all of us, including Dr. Murphy, Dr. Wenstrup. I want to point out to Mr. Blaze that you pointed out the 18.3% GDP last year. It was 17% in 2010, before the ACA kicked in. I've also been in business for years, and all the things we talked about, narrowing how much we could pay for our employees, we did all that through the 1990s and the 2000s, and by 2010, we could barely pay for any of it before ACA kicked in. So I'm thrilled that we're here to think about the ideas. Dealing with consolidation, which we've seen again and again, is a terrible thing. PBMs. I'm thrilled that we're not turning away people now because of pre-existing conditions, which I did more than once with my own employees, very, very sadly. So just let me lay 3 ideas out there for you. Number 1, claims data. Many of you already do this probably, but they're all payer claims databases collect healthcare claims. They're personally, I can say, great because Virginia has one. They can give state policymakers, private payers, and academics critical data that inform decisions about healthcare cost and quality. And I strongly believe that increasing claims transparency has the potential to increase the quality and delivery of healthcare in addition to making it more affordable. States are already leading the way in implementing this well-conceived innovation. Colorado used APCD data to assess differences in pricing for common procedures and how the utilization of healthcare services changes over time. You've certainly seen the examples of some places where there's lots and lots of C-sections and other places where there are virtually none with the same population. Oregon used the data to help guide its health system transformation, resulting in $139 million in savings from 2013 to 2014. Minnesota uses it. Colorado and Utah took different approaches to Medicaid expansion, and they were able to evaluate expansion through a more rigorous approach by using neighboring control state data. These myriad differences in state administration create many opportunities to compare states and evaluate differences. A second thing I want to talk about is improving diagnosis in medicine. Everyone knows the story of someone that took 6 years to get a diagnosis when it could have taken 2. According to the National Academy of Sciences, Engineering, and Medicine, diagnostic errors affect more than 12 million Americans every year. Study also found out that most people experience at least one diagnostic error in their lifetime, and postmortem research has shown that diagnostic errors contribute to approximately 10% of patient deaths. The estimates were that waste associated with diagnostic errors cost our healthcare system about $100 billion annually. Just imagine what that savings could do to the cost of healthcare. By the way, I forget which doctor it was, talked about the obnoxious part of government interfering in the relationship between a doctor and a patient. Let me promise you, way before there was ACA, you had insurance companies doing the exact same thing, to our great frustration. And lastly, I want to talk about ACA since, as my friend Dwight Evans said, it is the anniversary today. A key component has been many people have had insurance they've not been able to get before. Our uninsured rate's at an all-time low. More than 133 million Americans with pre-existing conditions protected after being denied coverage. This has been pivotal in many states. And one of the key things we can all agree on is the benefit to eliminating the lifetime caps and the creation of out-of-pocket cost caps. Before the ACA, insurance plans were not required to limit enrollees' total costs, and almost 1 in 5 people with employer coverage had no limit on out-of-pocket costs, meaning they were exposed to tens of thousands of dollars in medical bills before they became seriously ill. Again, let's not kid ourselves. Before ACA, the number one reason for bankruptcy in America was healthcare costs, and it still is today. This is something we have to work on together. And one last thing for my anti-choice Republican friends, whom I very much respect. ACA mandated birth control for all young women that wanted it. And we dropped abortions down to the lowest level since Roe v. Wade because of that. We also dropped the number of teen pregnancies in half. There were a lot of very good things that came out of it, and now we have to fix what didn't work. With that, I yield back.
Thank you. I now recognize the Congresswoman from New York, Ms. Tenney.
Thank you, Mr. Chairman and the ranking member. Thank you so much for your testimony today. This is a really important hearing, and I'm a small business owner as well, and as I travel across New York's 24th district, which is up in the big rural area, one of the largest agricultural districts in the Northeast, I hear the same thing from small businesses and employers who actually dominate our economy, that since Obamacare was enacted, the cost of their health insurance premiums have gone up, in many cases, 120 to 130%, and deductibles have gone up similarly. So you may actually have an insurance card, but you can't afford to go to the doctor, and that was the big fear that we all had. Now, I have a constituent who actually reached out to us, a guy named Ted Vanette. He's the owner of Design Concepts in Central Square, New York, in Oswego County. And this epitomizes the effect this has had on small businesses, and I wanted to share this with some of you. Before Obamacare, this company provided health insurance to their 38 employees with a premium of $20 a week and a deductible of $20, very affordable. Now the premium is $120 per week for his workers, and the deductible is $2,600. This is unsustainable and places enormous pressures on working-class families and companies which could use some of this money to hire additional workers, as Ms. Murphy just talked about, buying more inventory. And I'm also a family business owner, and our business has been around since 1946, but we've seen a lot of our businesses in our community fold because of health care. So our family insurance plan, our plan that we provided to our employees, we did that as a benefit. It wasn't a mandate, and we have over 50 employees, which means we fall within the mandated health care. So when some people say, well, gee, you know, we had to give up our health care, we don't have that option. We must provide the health care under the Obamacare legislation. And some of our increases for family plans are reaching $30,000 a year. Just got the latest numbers from my brother. So this is an enormous increase, and you know, it's really putting a burden on us getting quality care. And it also helps us attract great employees, because so many of our employees work for government, where they have government health care, whereas Mr. Murphy, or Dr. Murphy, Congressman, pointed out, sometimes hides the actual cost of health care. Wanted to first ask Mr. Blaze, because let's be honest, New York was terrible before Obamacare, it's even worse now, and we're treading down a really bad path. In fact, our legislature is considering doing Medicare for all, which would really, really be a problem for New York State. We'd probably have even more outmigration, the highest outmigration of people in the entire nation, by the way, and jobs. But to Mr. Blaze, I just want to ask you, as you know, the cost for healthcare providers has been skyrocketing due to inflation, but these providers are often locked into multi-year contracts. They can only raise their reimbursement fees accordingly for renegotiation. With that in mind, how long do you think, and to what extent will Americans feel the pinch of inflation on their medical bills? How is this going to change?
Yeah, actually, New York should have been the precursor that kept us from enacting ACA as price restrictions, because the New York's individual market was basically destroyed by a set of regulations which were then put into the ACA. And the reason that the ACA market continues to exist is because of the extraordinarily high level of subsidies. I think that healthcare inflation it's likely to continue. I mean, I think with if government policy continues to dramatically increase the subsidization, sort of these inefficient set of subsidies, without reforming those structures, without reforming, I mean, the path that the federal health programs are on. I mean, Medicare and Medicaid are both facing severe fiscal challenges. Medicare's unfunded liabilities exceed $50 trillion. I mean, that is a ton of additional government spending that is going to need to be financed by debt, which will translate into higher interest rates and higher inflation.
Right, and of course, New York State, there's no incentive to lower our costs for Medicaid because they get the federal reimbursement for the subsidy. But thank you for your comments, I appreciate it. Mr. Niswander, I just want to ask you, if I could, in your testimony, you highlighted the outrageous amount it would cost your practice to offer health insurance to your employees. If your practice was able to access one of these association health plans or another method to access more affordable care, do you think that would impact your employee practice? Would it help you if you had access to more?
Yes, rural America is struggling right now to attract the best talent, and just numbers. We can't get specialists, we can't get surgeons, we can't get psychiatrists, not just in my practice, but the hospitals and the counties surrounding me. All the rural counties in Tennessee are struggling to maintain the labor workforce, which between the expenses of operating a small business or a rural hospital and not being able to get your labor workforce, which is forcing so many practices to close, that would definitely help us to retain the best and the greatest surgeons and physicians and nurse practitioners that we can find.
Thank you so much. My time's expired. I'd love to continue this conversation. Thank you.
I now recognize the congressman from Utah, Mr. Moore.
Thank you, Chairman, Ranking Member. Our witnesses, thanks for being here today, for sticking it out with us, even with a bit of a overactive heater as well. You've endured quite a bit today. Look, when I talk to my constituents from Utah, and particularly some of my rural areas, the things that they've come back with to me, from Cache County, the staggered at the cost of his monthly insurance premiums and out-of-pocket costs. A constituent from Brigham City put it simply, we're just paying more and getting less, right? That's been a consistent theme that we've seen. This is a really unique opportunity to be on the Health Subcommittee in this really important committee, Ways and Means. Healthcare, anything expenditures related to health are our nation's #1 expense, right? When you put it all together. And the topics that we've talked about today and Dr. Murphy's testimony, that's not going to get played on a loop today on cable news. It's not what people are, interested. It's not the most, vibrant topic to put out there in the world. It is the most important thing, and every single business owner and family recognizes that. And so we have a real opportunity to do something here and avoid the platitudes that we oftentimes hear. And there's going to be a couple platitudes that I'm going to mention. Mr. Blaze, I'm going to ask you to address it, because sometimes you hear some of these overarching issues get mentioned without a lot of context. I'm going to ask you to put a little bit of meat on the bones to the concept of price transparency and improved quality transparency. Like what would you add to that, what that can do to lower healthcare? You mentioned that Congress should trust people to make health decisions for themselves, and that price transparency will encourage more consumers to shop and obtain lower prices. And patients don't always shop for their health care because it's a complex system. So put some context to those two overarching concepts of price transparency and quality transparency.
Yeah, so thank you, Congressman. That's a great question. People know prices when they shop for everything else, and they're able to figure things out. So I think they can figure things out in healthcare as well, but they need to know what the prices are. So the Trump administration finalized 2 rules, one that requires hospitals to provide price information, another rule that requires insurers to provide price information. See, the hospitals and insurers are beginning to comply with those provisions, and I think we can see when consumers have price information, when they have incentives to act on the price information, such as they have a health savings account, they shop and they make wise decisions. They save money. They don't skimp on anything that would reduce their health care. I think for employers need price information as well. Like, they're contracting with insurers to manage their benefits, and a lot of insurers have not negotiated great rates for those employers. And I think the price information is going to help employers better to monitor how the insurers are functioning. And on quality information, I think one of the things that is very clear is that there's a wide variety of outcomes that come from healthcare providers. And patients should know the quality of the providers that they're seeing. So, if they're going in for cardiac care, they're going to providers that have, low complication rates.
We do such a good job in this country with allowing for industries and consumers to dictate where things go with our typical economic principles of supply and demand. We've overcomplicated this system to the extent that we are not giving the power back to the consumers. And so I appreciate that context. One other last topic just to have you, touch on is the is overconsumption. So overconsumption, you've talked about turning the tide on red ink in your report and describe how insurance can be designed to protect consumers from this catastrophic harm while not facilitating overconsumption. That drives up costs. Can you share a little bit more just on specific plain terms on what this means?
Yeah, I mean, the analogy is if your auto insurance pays for your oil change, right, you're not going to be sensitive to the cost of that oil change. There are many things in healthcare, like health insurance is great. It provides financial protection for low probability, high expense events, but insurance is not the most appropriate way to pay for every healthcare expenditure. It discourages individuals to care about what the costs of those expenditures are, which again increases prices, which increases what we all are paying because of how heavily the government is subsidizing healthcare and health insurance.
Thank you, Dr. Blaze. I yield back.
I now recognize the Congresswoman from California, Ms. Steele.
Thank you, Mr. Chairman, and thank you for all being here today. And my constituents are anxious about the economy, and for a good reason. President Biden's inflation crisis has impacted everything, the cost of groceries, to the price at the pump, and even healthcare spending. Medical inflation has led to 43% of adults or their family members to put off or postpone needed health care due to increased medical costs, severely impacting Hispanic and AAPI communities the most, according to recent data from the Kaiser Family Foundation. So we've been hearing from the other side of the aisle that how important this permanent telehealth bill is. I was not even a member of Ways and Means Committee at that time. I introduced the permanent telehealth bill in 2021. The other side of the aisle only extended 1 year and failed to extend the first dollar coverage of high deductible health savings plan for the first 3 months in 2022. I introduced again last year that another permanent telehealth bill in 2022. The other side of the aisle extended only 2 years last year. Now I hear from Congressman Thompson on the other side of the aisle that he agrees this telehealth bill is very important to make it permanent. So I will introduce this telehealth bill again for American people. So I'll do that, and hopefully it's going to be agreed by the other side of the aisle. So I'm asking Mrs. Kerrigan, if this were to expire again, how would this impact your members?
Well, I think it can expire. You're talking about the telehealth piece,
Right.
correct? Look, I mean, one of the silver linings of the pandemic was, again, sort of that everyone turned to technology, right? Pivoted to technology, and we saw 35 million Americans using telehealth, to get their health care, whether, families, individuals, senior Americans. So, and it's a very, very important piece, I think, to maintain as part of our healthcare system. I think particularly, again, for those people who can't travel to the doctors, for rural America, once we get them broadband, all areas of the country broadband. So it would negatively impact a lot of individuals and businesses. It saves time, it saves money, and it would be a backward step if we didn't move forward with permanency.
Thank you so much. In California, we shut down all the businesses and all the schools. Actually, in Los Angeles County, today's the third day that kids cannot go back to school. So this is what's going on in California. We really needed this telehealth bill that permanently passed, and that we're going to work on it. So California announced that, Dr. Nice-Wonder, California recently witnessed Madera Community Hospital's closure, impacting hardworking taxpayers the most, with very limited options nearby that you talked about a little bit about the hospitals. With medical inflation, supply chain issues, and labor expenses, what are the consequences of medical practice closures? And with your experience, how do closures combined with rising medical costs impact? You've been talking about your businesses. How about the patient?
Yeah, so I appreciate the promotion calling me doctor, but I'm a family nurse practitioner. That's flattering, thank you. So you're talking a lot about quality measures, and lots of studies have actually looked at that, and they've shown that as Medicaid enrollment increased, quality of care did not equal, or increased Medicaid enrollment did not equal more utilization or higher quality of care. The Bureau of Labor and Statistics, through many studies, uses if somebody spends more than 5% of their out-of-pocket expenses on healthcare costs, they are considered uninsured. We're talking about a $5,000 premium a year, a $14,000 deductible for somebody that makes $36,000 a year. That's uninsured, even though they've got a card with their name on it. This is like setting up a hamburger stand in a town full of vegans. They're just not going to use it. The access to care is definitely a problem, and we need to find a way to change that. The access is the issue. In Tennessee, rural hospitals and physicians' offices are closing left and right. The patients are the ones suffering from these increased premiums, the increasing deductibles that they can't afford to pay, working families like me, but they can't find a provider that even takes that insurance in their area.
Thank you so much. Mr. Chairman, I yield back.
Thank you. I now recognize the Congresswoman from Alabama, Ms. Sewell.
Thank you, Chairman Buchanan and Ranking Member Doggett. I want to thank all of our witnesses today. Today is the 13th anniversary of the Affordable Care Act, and thanks to the Affordable Care Act, millions of Americans are able to afford health coverage that was completely out of reach before its passage 13 years ago. I have testimony for the record from over 30 patient groups, including ALS Association, the American Cancer Society, the American Diabetes Association, to name a few, stating the importance of the expanded healthcare coverage that the ACA provided to more than 120 million people with pre-existing conditions. And I'd like, for the record, Mr. Chairman, to include it in the record. My constituents in Alabama are disproportionately impacted by chronic health conditions, including diabetes, heart disease, and cancer. Sonia, a constituent of mine from Montgomery, Alabama, wrote to me about her father, who had been denied coverage prior to the enactment of the Affordable Care Act's pre-existing conditions protection due to his cancer diagnosis. Sonia wrote that her family prayed that it would stay in place because of the security that this protection offered her and her family. For millions of low-wage workers, the ACA expanded access and affordability through Medicaid expansion, making this one of the most transformational policies of our time. Uninsured rates in expansion states plummeted in the years following the ACA's implementation. Medicaid expansion has helped patients access preventive care like cancer screenings, increase access to transplants, and made diabetes medication more affordable. Unfortunately, millions of Americans have experienced none of these gains simply because of where they live. You see, my state, the state of Alabama, has not expanded Medicaid. And when I think about the many hospitals that have closed in the rural parts of my district, I was not surprised, although I was shocked, that 85% in the last 10 years of rural hospitals that have been closed in states that did not expand Medicaid. The Affordable Care Act is the law of the land. I believe in this great country that no person should not be able to have affordable access to affordable and quality health care. I believe that it should be a right. The fact that we are the last of the industrialized countries in the world to not have universal health care as a part of our DNA, it really does sadden me. And it saddens me because we get caught up in names and titles. I think about my constituent, Hank. And Hank is a farmer a fifth-generation farmer, and had farmed all his life. And his dad farmed and his grandfather farmed. He was a third-generation farmer who never was able to afford health care. In 2014, a navigator named Doug visited Hank on his farm to get him and his family enrolled in the Affordable Care Act. And even though Hank wasn't a supporter of President Obama, he signed up for a Blue Cross plan that cost him only $100 a month, thanks to the premium tax credits and cost-sharing reductions. The following summer, Hank was working on his farm when his hand got caught in his hay baler. When he tried to pull his right hand out, his left hand got stuck as well. The family's plan, which they had had for less than a year, covered the emergency air, flight, and his hospital bill. Hank was able to avoid a financial catastrophe, like so many Americans experience who are uninsured. Clearly, Hank's story serves as an example of how the Affordable Care Act does protect millions of Americans from devastating medical debt. The sad part about it, and Hank admitted it to me, when the navigator knocked on his door, he said, "Do you want to have health care insurance, affordable health care insurance?" He didn't say, "Do you want to be enrolled in Obamacare?" And Hank admitted to me, had he said, "Do you want to be enrolled in Obamacare?" he probably would not have had this life-saving insurance that literally saved his family from catastrophe. Mr. Chairman, I hope that we can put politics aside and really think about what's in the best interest of all the people. I'm talking specifically to my state. I really hope that they will take an opportunity to expand Medicaid so that more and more people can get insured. In fact, for the 2022 coverage, over 200,000 Alabamians enrolled in the exchange. Just how many more would have also enrolled had we expanded Medicaid? Thanks.
Thank you, and I want to thank all of our witnesses. You don't realize how big of a positive impact you have on a panel like this, because a lot of people don't understand sometimes the real world. And I can tell you, I chaired our local chamber in Sarasota. We had about 2,600 businesses at the time, and they told me, I was kind of shocked, 90% were 20 employees or less. That's America. And we've got to do more to help you, not just in the healthcare space, regulation and other things, to make it simpler for you and keep your taxes low. Because people say, well, why do you always talk about the small business or medium business? I said, because they're the job creators. The better you do, the better America does. So that's the mindset some of us have. I know my good friend Mike and others and Carol, we have the same mindset if you're in business. But again, the better you do, the better the country does. So I really appreciate you being here. It's made a big difference. You guys were all very impactful. Please be advised that members have 2 weeks to submit written questions to answer later in writing. Those questions and your answers will be made part of the formal hearing record. With that, the committee stands adjourned.
Thank you. Y'all did the same. You talked about all the things that are out of my wheelhouse, the facts and the figures, but